So first of all, hello friends, good afternoon from USA. I am talking directly from San Francisco American Diabetic Association meeting where it is happening. We have with us one of our international expert from Tatjana she is from Macedonia. She is a regular international faculty for many of the meeting. She is also the member for IDF from her country, and she regularly visits our country also to India in our Diabetes India meeting. So first foremost thing which I want to ask you that what are the differentiation you might be attending, and this year I had seen during ADA things are moving around continuous glucose monitoring. So a new thing had come about the continuous glucose monitoring. Would you like to talk about that?
Yes, there is a new approach in glucose continuous monitoring, like a long-lasting sensor, which you can apply very easy subcutaneously, and it lasts for 6 months. 6 months. And what is important about these sensors that the people, mainly with type 1 diabetes, are able to stay in range more than 59% of their time during wearing this sensor, and also they can detect the hypos more than 95%, which is very great improvement in their treatment. And of course, they can re-implant these sensors many times, and it helps them to be in a very tight control, avoiding hypo, and majority of time be in range, what is very important for delaying chronic complication of this disease.
So it is one of the important technology breakthrough, which I will say that in continuous glucose monitoring since last almost 10-15 years, it was there with the Dexcom, started with 3 days, 5 days, 7 days. Then we have Libre Pro, which had come for 2 weeks. But this is something new had come, that you put it under the subcutaneous tissue, implanted, and then for 6 months you can see continuously glucose monitoring.
So
the data was published was really very promising, because it shows a lot of hypoglycemia which can be reduced because of using the Eversense continuous glucose monitoring for 6 months, and simultaneously these type 1 diabetic patients can keep their sugar in range, in range for most of the time.
For most of the time, and even the projections are that it can be prolonged up to 12 months in the near future.
The near future, the further progress will be there for even for 12 months also. And it was really very promising data was shown that, and it is already available in US market. And in India they are looking for, so probably by this year end we will be having in India also. In some of the European market it is already available. In
US it is available. It was approved by the FDA a couple of days before this meeting.
So with the Roche, it is available with the Roche.
Yeah.
What else? I mean, you are very much interested in nutrition, so I just want to ask what is new in nutrition side.
Yes, this is my main topic about nutrition and education. And now there is also the new consensus statement regarding other recommendations about nutrition. And the main difference is that there is no strict percentage of main nutrients in the daily plan for nutrition of people with diabetes. So there is no just this percent of carbs, proteins, or lipids, but it can be, the diet must be tailored individually, and mostly suggested diets are low-carb diets, and also Mediterranean diets, and a couple of others, but these may be the most, because these kind of diets promotes lower hemoglobin A1C, also fasting plasma glycemia, and the people are with better outcome with these diets. The main problem is that there is no proven longer benefits, but the studies are ongoing, and maybe it will be in the near future. And also that there is, we can say that there is no diet which is not good for people with diabetes, but it is important that to be balanced, to contains all major and important nutrition components in order to to stay in good metabolic control.
So any paper which you could go through, like for intermittent fasting or like for this keto diet, which had become very hype,
Yes.
So we agree with the low carb diet and with that, but I just wanted to know a few words about the keto diet and intermittent fasting.
Yes, about intermittent fasting, because it is a little bit popular these last days. Up to now, the scientific proofs for this diet that there is no benefits regarding metabolic control, just on losing body weight.
And what about the keto diet?
And the keto diet, well, it is actually low carb diet or very low carb diet. If it is a little bit higher in fat, that is the keto diet. So it is proven that it is quite safe diet, and also can be a good diet plan for people with diabetes. It is very important that what diet the person will choose. It depends on his preferences, on his habits, how to eat, and how to adjust the food to his everyday life. So it is not strictly recommended one kind of diet, and there is no diet that one diet that will fit for everyone. But the diet must be individualized for that person.
For most of the
patients. For most of the patients individually.
Anything new other than that? Like NASH, this time many topics were related to the NASH, as we know that a number of persons with NASH is increasing because of the metabolic syndrome, and increasing the incidence of NASH along with diabetes is increasing. So anything new, something which you want to share with for NASH?
Yes, it's only about NASH. Here in USA, it's maybe first reason for hepatic cancer, NASH. But up to now, we do not still know what is the best marker for diagnosis of kind of NASH that will lead to further damage of liver.
So we don't know how many patients with NASH will develop the cirrhosis or hepatocellular carcinomas.
Or how is just a benign deposit of fat. And we know that pioglitazone can be very effective.
We do use a lot of patients in India.
Yeah.
Like when we see the patient with slightly higher SGPT, SGOT, our first choice of the therapy goes with the glitazones. And now
glitazones, because they are distribute visceral to subcutaneous
and that's how
tissues.
It reduces
so that is the mechanism how they are working, and it is proven that they can
But
reduce.
there was no talk related to pioglitazone here.
No.
But like for an Indian diabetes meeting, it won't be, without pioglitazone, there won't be any conference.
I think so. That's a little bit forgotten drug, because even in the new consensus statement,
they had put
in the
low-cost therapy.
In the low-cost therapy, but not. I think so. That's not just low-cost.
But what about in your country? Drug. For India, we do use still as one of the choice of the therapy, unless the patient goes in LV dysfunction.
Also, we do use with cautious, because we know what is the side effect in those with heart failure, and also in a longer duration of treatment about bladder cancer. So osteoporosis and etc. So if you are giving this drug to the right person, which are young, obese, with predominant insulin resistance, I think so that's an excellent drug at the beginning.
The same thing what we do in our country.
Yes.
Also. So with this, thank you once again. Thanks very much.